Hello everyone. Now we are going to start our lecture for today. Today is the second lecture. We are going to study about the foundation of public health law. Additionally, we can go through the regulation and also the local enforcement. Yeah, we are going to know about the constitution of the law. Additionally, we are going to teach about the act or law. Lastly, also we can go to explain about the regulation. Last one, we are going to explain about the local enforcement. The objective of this lecture, we are going to understanding the meaning of law. Additionally, the regulation. Moreover, local order in public health law. This is the first objective.
Doctor, sorry, up your voice.
Okay, the law is the voice. It is not clear. How about now? Now is it clear?
Yeah, for me, no problem.
Okay, okay. The first objective, as I mentioned, to understand the meaning of the law and regulation and local order. The second objective of this lecture, to know the hierarchy of the law and how they can protect the health. Last third objective of this lecture, identify Sudan key of Public Health Law 1975 Public Health Act. And also we can go to see the analyze the real example of local order and enforcement challenge. This is the main objective of this lecture of today. Now let us to see the concept define the public health legal framework. One of them, legislation. What does mean the legislation? Legislation, it is official rule made by government, like constitute. This is a call it legislation. Sometimes people they call it in Arabic call it dastur. Yeah, this is a example or legislation. Additionally, the second concept of the law is according the law themselves. Yeah, like law of the public health law 1975. This is the law. Yeah, which include the punishment and breaking them. Additionally, example the mandatory, like example like mandatory for vaccination during the outbreak. This is the law. Yeah, as I mentioned, 1975. This is the call it law. Another word is call it regulation. The regulation is the details of the law. The law have many articles, and all the law they are going to break down like Article 1, Article 2, Article 3. This is the call it regulation. The detailed instruction how we can follow this law. This is the call it regulation. Example, Minister of the Health rules on the restaurants cleanliness. Yeah, this is the one of article of the Food Act. Last concept is the local orders. The local order, this is the specific rules they're designed by the local community at the local level. Yeah, it is not even not at the state level. or even not at the federal level. Yeah, this is designed at the local. Yeah, when that locality sees there is some public health issue, the panel or the panel or governor of that law they are sit and discuss that issue, how they can handle or how can solve that problem. Yeah, based on that they can put it order. This order must be applied at that area or at that locality. Yeah, like example in Dalinge locality, not generalized to another state, even to another locality. This is the call it local order. Yeah, this is the hierarchical or framework of the local. As I mentioned, first one, the legislation. The legislation is formed or do by the country at the country level. As you see in 2019 and 19, in Sudan, Sudan constitutes their do the SAMSA legislation. Yeah, when their new government come, they are do the legislation. Yeah, this is the first layer or first hierarchy of the law. It is official do by the country level. Dastur, they are put it in the dastur of the country. Yeah. After that, when they are approve it in the parliament, when the parliament members see that legislation and approve it, that will become law. Yeah, when become law, that means they are going to apply to the community or to the people. The law, even the law, they have the need the details, need explanation, or the law have the many articles. Yeah, in that articles, they explain you how you are going to apply this law. Article 1, Article 2 explain what does mean that word and how you can punish if someone is panel or convinced that article. Yeah. This is a called regulation. Last point, as I mentioned, this is called local order. Local order is the designing by the panel of the locality, not even at the state level. Sometimes it will be at the state level, and but mainly is focusing in the local level. Yeah, this is a concept. Yeah, of the of the public health legal framework. I hope you are get this three word or four word: legislation and also law and regulation and local disorder. Is it clear? This slide, because it's very important for you to understand it. Welcome. I saw someone raise his hand. For you, you can. You need to say something? Okay, doesn't matter. Now we can go to a hierarchy of public health law. The public health law is operates the clear structure and also ensuring the comprehensive covering from the foundational right to local specific. Yeah. One of them is the called Constitution Foundation. As I mentioned, this is the high laws ensuring the fundamental high law ensuring the fundamental right. Like Sudan in 2019, the constitution guarantees the right for the health for the all citizens. This is a call it one level of the hierarchy is called the constitution foundation. Yeah, this is at the state level. Yeah, as I mentioned, the Constitution Foundation. This is the call it Dasturia. This is the call it Dastur. The second level is the call it Act or Status. The law passed by the National Parliament in the 1975 Public Health Law mandates the essential health service, including the clean waters. Yeah, this is a like act. As I mentioned, the constitution. This is a just suggestion from at the country level to approve this law or this legislation. They must go to parliament, national parliament. When they get the approval from the national parliament, this will call it the act or law. As they mentioned here in the example, in 1975, the Public Health Act or Public Health Law approved by the Parliament, and they mentioned is the essential health service, including including the water, clean water to the citizens or to the population. Yeah, this is the second. The third one called it regulation. The details the rule set by the minister to implement the act. This is the details. If you need to apply that law or that act, you have to detail that rule, to explain the people, to let them to understand that law. Like establish specific standard for the water testing and quality. There in the act we are mentioned, we need the clean water for the population. Here they explain the standard. What does mean the clean waters or good quality water? They give them the good details, yeah, that can let the people to understand or to aware. The fourth, the last concept is the local order, the rule adopted by the city or village council. Local council enforce the quality water, adapted their specific geographical and community need. Based on the community need, if that community have some problem, the community council they sit and decide some law. That law or that rule or that order can help them to organize their health issue or their health problem. Yeah. This is a hierarchy. As I mentioned, one of them, the Constitution Foundation. Second is the call it act or status. The third is the regulation, and the last one is the local. In the constitution, as I mentioned, is founded by the country. When they founded by the country, is pass this law to the parliament, national parliament. When this law approved from the national parliament, is a call it law or call it act. Another thing, when they approve it from the national parliament, they are going to explain more about law, explain in their articles to let the community or the population to understand that law, or even to help to public health professional to apply that law, yeah, to explain what does mean Article 1, Article 2, Article 3, to understand very well. Last last point, which also I go through it, local order. As I mentioned, the problem is different from place to place. When some community or some locality facing by the health problem or health issue, the council of that community they will sit and design the order. That order can let them to organize their things very well. Yeah, this is a call it a local order. Now let us to go to next slide. In this slide is a case study. One example of the law, the Sudan Act or Public Health Law 1975. The key, it is some example that you it happen. The key provision, as I mentioned, the law have the many articles and many chapters. In the example of this this law, it is a first chapter is a call it like key provision. The main point which included for this from this law, like disease control. The disease control that means or explain the empowering the authorities to implement quarantine measure during the outbreak. Example, cholera or mandatory or mandate for reporting infectious disease. For example, malaria. In this law or in 1975 law, there are some article called it disease control. In this article, they request to implement quarantine measurement. Example, if some outbreak like cholera or AWD or even malaria taking place, outbreak in some place, they must apply the quarantine measurement. Quarantine measurement, that means those people they suspected, they can put it in quarantine, even to realize those it is not affected by disease. This is the one. Additionally, can do the import entry and entry gate of the country. They can do the investigation to avoid the spread of the disease. Yeah, this is the quarantine measurement. Can follow the measurement of the quarantine. Secondly, they mandate to report at the health authorities or even at the community. If there's some outbreak take place in your area or even your state, you have to report the authorities. Like example here, if you in Sudan or in or in some countries or in some state, if you have your neighbor or some people has been affected, you have to notify to the health ministry of the health to be aware there is some outbreak take place. Example in Dalingi, also in Niala or in what else place, you have to have notify the authorities. Yeah, that can let the authorities to do their best. Yeah, how can control or how can handle that. Yeah, this is mentioned in the disease control to apply for the quarantine measurement, and additionally can do the report. Yeah, we have like 60 or 10 cases of the out of them cholera or 100 case of the AWD, you have to do the notify or report to health authorities. Yeah, this is mandatory. This is mentioned in the Public Health Law 1975. Yeah. Additionally, there are some articles explain about the facility regulation. In the facility regulation, record to health all health facilities to have the license. Yeah, to have the license and set the standard for the medical safe disposal. Also in this law, there are requests from the all health facilities or health centers, even hospital, yeah, to have the good to have the license. This license give them by the medical council. Yeah, if you need to establish the health center or even to establish a hospital, you have the license. To give you the license, the teams of the council of the medical council they can visit and assess to see the request. Is it this health center or this hospital? Is it have the good specification for to receive the community or to see the people have this or not? Yeah, yeah. This after that, when they see you have the good service, you have good machines, you have good place, they can give you license. Yeah, yeah. This also the request from the Public Health Act. Also, in the another point, the request enforce the panel. Hello, I don't know
Hi.
who is going there.
Where?
Hello?
Go ahead.
Is it clear now?
Yeah, case study of Sudanese
Yeah, but I
1975
think there is a
population.
reflection of the voice here.
About me? It's not clear?
Yeah, there is some reflection, but I don't know. But let us
Yeah, because
continue.
because our network is not so good.
Okay, good, yeah.
That is a problem. Yeah.
Enforcement and panel. Also, in this act, also they are mentioned. There is fines and impression for those not follow this act. Yes. Last point, we are going to see the challenge, despite of the foundation rules, some parts are out, out update here. There is some health ministry, they not follow or not update of the health regulation. Now let us to go to next slide. But I don't know how exactly. Hello?
Yeah, keep.
I don't know. Is it my voice? Is it clear? Because I see the some sound reflection.
No, your voice not clear. Okay. Still there are some voice come.
What? Okay.
So raise up your voice in order to understand all these
Yeah.
things.
Yeah. Hello.
Yeah.
Someone is put it out microphone or what is happening? Hello.
Yeah. My microphone is open.
Yeah. Close it. Hello. Yeah. This is good. Now it's good. Huh? In the local order, as I mentioned, the local order, that means the order is designed by the local panel. If they have the some problem, they can design the order to organize that problem or to solve that problem. Yeah, this is the call it local order. Local orders are the crucial for addressing the unique health challenges that national law may overlook. There's some challenges the national law they couldn't see it or couldn't cover it. That's why the local order law they're designed to handle this issue and to do adapted by the specific community. Example, in Khartoum state, there is a Khartoum water pollution control order. This is specific by the Khartoum, no another state in the Sudan. Yeah, the problem industrial waste contaminated the Nile River. Rule mandate for pre-treatment for the factory influence impact clean water vital for the drinking and agriculture and reducing the waterborne disease. Yeah. This order is specified by the Khartoum state. In this order, they request from the industries they must have do the pre-treatment in the during the manufacturing they produce the liquid waste and this liquid waste they directly discharge in the river. When this liquid waste are discharged in the river, like Blue Nile or White Nile, that can affect for the microorganism or life inside that water. Fish and also another organism they is going to kill them. Additionally, even can let the water be more contaminated because at some area the people they are use the direct water from the river. That's why they are designed this order to protect this river or to protect that water. This is the call it local order, just specified by the Khartoum state. The request from the industry to do the pre-treatment before discharge the liquid waste to the river. They must do the pre-treatment to reduce the toxic of that liquid waste. Yeah. And after that, they are doing the order. This is specified by the Khartoum locality. Second is the Darfur Epidemic Response Order. This also is specified by the Darfur exactly. The problem, high disease spread in displaced person like camps. Rule, require immediately disease report by health workers. Impact, facilities rapid intervention and prevention, large scale of outbreak in vulnerable population. Also, this order is specified by the Darfur. There is a high rapid outbreak take place in Darfur, especially in the camp IDPs area. When they realize that many times the outbreak take place in the Darfur, they are do the order. In this order, they are request from the health workers. If they see some disease or some outbreak, definitely or directly they have to notify the health authorities. That can let them to take their response as soon as possible to avoid to increase or extend this disease. This is the second order is specified by the Darfur. As you know, the health system is very fragile. It is not good. This is call it the local order. Local order, as I mentioned, is specified by the specific group. I give you two examples or two cases. One of them Khartoum State, and another is the Darfur Epidemic Rapid Order. Now let us to see the enforcement and mechanism of the rules in Sudan. How we can let the rules of public health in Sudan to be more enforcement or more postering or more followers or working good in Sudan. One of them is the monitoring compliance. The health inspectors conduct routine visits to restaurants and hospitals and factories to ensure adherence standard. This is the one. To let the public health law working in Sudan, there is request from the health inspectors like you to do the contact and a routine visit in restaurants. As you know, even in the restaurants, there is a law like Food Act Law 2073. They organize the food in the at the restaurant level. Also, you are studying the, I don't know, you teach or not in field training. There is some requirements to give the license to the restaurants. To let the public health law work good, is very important to do routine inspection at the restaurants to see they follow the public restaurant law or not, Additionally, in the hospital to see is it follow the regulation or not. Additionally, in factory also to make sure they are follow the requirement that put it by the law or not. Yeah, this is the one health inspector. Secondly, at the community level, the community watch, local community also they play vital role in the reporting environment, health hazards and non-compliance. Sometimes the some industry, when they are established as the one else or at the some place, they couldn't follow the Public Health Act as in the Environmental Health Act or also in the Environmental Protection Act in 2003. There is some requirement if you need to establish the SAMSA industry or the SAMSA project, you have to follow that. Yeah. Also, to let the public health law working very well, even require from the community to do the notify. If found that some activities affect to the environment, to do the notify to the authorities. Yeah. This is the first point. Monitoring and compliance to see data factories or restaurants or hospital, even the industry, is it follow the health regulation or not? This is the one called the monitoring compliance. Secondly, panel for the violence. Some people they couldn't follow that requirement, or some industry they must panel them for violation. The financial panel can take them money for them. Financial panel for the health violation such as illegal waste disposal. If also their request to dispose of liquid waste as a specific place. If you not follow that requirement, you have a panel, impose the panel. Secondly, for the facility closure. If your hospital or if your restaurant not follow that, they must close it. Yeah. This is the two way to enforce or let the public health law work in Sudan. As I mentioned, monitoring is the monitoring from the health inspector. Secondly, for even for the community. Last point also panel and violation for those they couldn't follow the specification or legislation of the public health. They must panel them. Also, even can close that facilities. Yeah. The last or three point or three important to let the public health law work well, the stakeholders, the leaders, the Ministry of the Health develop and oversee the implementation of the health regulation. The Ministry of the Health, they must follow to see is it health regulation follow it or apply it or not apply it. Yeah. This is the one. This is handled by Minister of the Health. Secondly, the police force provide support to enforce public health order to ensuring the compliance. If the some country or the some person not follow the public health regulation or they must force them by the police. Then they can go to court and see handle that issue. Jurisdiction, administrative justice and adjudicating case for the non-compliance at the court level. There is some case or some people, even some factory, if not follow the regulation, they must judge them. The last point is the non-governmental organization or NGOs play the crucial role in the public health education and community mobilization. The NGOs can let the community aware by their right and also aware the importance of the applying of the health law and advocates to let them to be strong to follow apply of the public health law. This is how we can enforce the mechanism of healthy rule in Sudan. I mentioned by the three, one of them monitoring, compliance. Secondly, panel surveillance. Third one is the key stakeholders. Now we can see some challenges. To apply the public health law, also there are some challenges. One of them, the resource scarcity. We not have sometimes in Sudan they not or we not have the enough resource. This can also affect for the applying of the health law. Resource scarcity, insufficient number of training inspector. Even during the resource scarcity, there is some health inspector, even they couldn't get in the training, or even their number, it is not enough to follow all industries or all facilities to follow to see the health regulation. Secondly, lack of funding for essential service like regular water quality testing. Also there is no enough funding to do the surface testing for the water quality, as you know, the pollen test or also the another test to make sure that water give our community is free from the microorganism. Additionally, the conflict or instability, as you know, the ongoing conflict which is taking place in Sudan, 2003 up to date, also is affect to apply the public health law, the severity of public health infrastructure, and also make the extremely challenges. Displacement of the population lead to overburdening the health service and also difficulties to maintain the standard when there are overpopulation or many people, even they are suffering to get the basic needs. It's difficult to apply all the public health regulation or public health law. Last challenges for the public health law in Sudan is the limit public health awareness. Many citizens do not fully comprehend important national behind the health law. Many people they not aware, not know the importance of the health law for them health or for themselves. Additionally, lack of target public health campaign and community engagement initiative to educate the population. Also, we not have enough of the initiation of to understanding or to upgrade the awareness of our community. Yes. I think this is the last. Slide for our session today. Now, the floor for you. If there are some question or comment, the floor for you. Now, you are welcome. Is there some question or comment? This lecture is recorded. I will share in my YouTube channel, and then I can put it the link in the Classera. Additionally, I prepare the material in PDF. Also, I will share with you in Classera platform. Can be accessed for all of you to go through it. If no question, I will say thank you for you and have a good moment.